student, today we will discuss about one more male reproductive disorder, that is phimosis. So before we could discuss, we will brush up the anatomy of male reproductive system. So in my previous video I explained about parts of the male reproductive system. In that, one is a penis also. So the part of the penis is this is a gland penis, this is a meatus, means urethral opening. So above the gland penis one covering is there, that is called as the skin, foreskin. It covers the gland penis, and this foreskin can be retracted back. Okay, so after the urination or during the bath and all, this foreskin has to make it up, and this area has to clean, because after the urination and due to congestion, here the deposition will take place. The deposition has to clean, otherwise what happens, due to collection of that, the inflammation takes place, and that inflammation may ascend inside. It leads to UTI as well as it will inflame the other reproductive organ. To prevent that, maintaining personal hygiene is very important part from the men. Okay. Now next we'll move on. What is phimosis? Okay, phimosis means inability to retract the foreskin over gland penis. So just we saw gland penis, over that foreskin is situated. I said the foreskin be retracted back, but in this condition it is unable to retract back, unable to pull it back, and unable to clean it. So what may be the causes for that? It may be due to recurrent inflammation. If the client is not maintaining good personal hygiene, as well as like a multiple sexual partner suffering with a STD, in such condition there is more chance to get the phimosis. So there are two types is there. One is a congenital and one more is a acquired. Congenital means by birth only the child is getting. Acquired means after the birth due to many other causes, as I said. So you can see in a picture. See, this is a gland penis. So over the gland penis, this is the foreskin, and this foreskin can be retracted. See here, retracted, and this part can be cleaned. But in phimosis, it is completely covered like this. It cannot make it up. That is an abnormal condition. Normally it can be make it up. Okay, so in such conditions, so when it is not able to make it up, what may be the signs and symptoms? There will be a pain will be there when the client is trying to pull it back. There will be severe pain, discomfort will be there, inability to retract the foreskin. So due to that deposition, inside the deposition, the remaining, it causes inflammation and a recurrent UTI, urinary tract infection. Due to that UTI, client may get fever and other symptoms also. What may be the management? When it is inability to retract by the foreskin, there is the management itself, that is a surgery, and it is a minor surgery. Only like many days of admission in a hospital is not at all required. Under local anesthesia, doctor is doing circumcision. Circumcision means that around the gland penis, that foreskin is there. No, in the picture you can see that foreskin will be removed. So after the removing, it is dressed with the sterile dressing is done by applying the betamethasone cream. It is a corticosteroid in order to prevent the infection and inflammation. Otherwise it will spread and it leads to reproductive organ infection. To prevent that, so what may be the, see, you can see in a picture. See, this is a way they will do. They will just remove this in a minor OT. Okay, minor or a major OT, but it is a minor surgery. Okay, after the surgery, after the few hours of observation, the client may be discharged with the instruction. So what may be the nursing management? As a nurses, it is our responsibility educating the client. If it is an adult, means educating him not to make it wet and change the dressing and area to keep clean. After the this area cleaning, to apply the ointment. Psychological support. Since it is a sexual organ, the client may think, okay, in future, like his sexual life is damaged, or some kind of a thought he may get. So so giving proper education, guidance and counseling to the client, and a follow-up when doctors say with a blood report or whatever, the follow-up is a must. If it is a child, means the explanation should be given to the parents, same above advise cleaning and psychological support to the parent, personal hygiene to maintain and not to wet the part. So this is regarding the phimosis, student. I hope you understood. Thank you.